Strike. All right. Do you need anything?
Probably need a comb. No?
Wait, let me. Yeah.
Do you have any questions?
No, I'm excited to get started.
Okay. Let's talk about insurance.
New England Life Care is a 500-person strong home infusion organization.
Our mission is to provide support in the home for infusion services of both acute therapies, and then we also do management of chronic diseases.
We have 4 branch pharmacy locations, compounding medication only for our patients. That medication's then delivered, and our nursing staff are infusing our patients in the comfort of their own homes.
So we're really full cycle here and very robust for being a small but mighty nonprofit.
So when I joined New England Life Care 5 years ago, overseeing the entire department, I quickly found that the organization had a benefits crisis. The normal group medical program that New England Life Care had been living with for quite a few years was facing a 39% renewal. That would compound itself year after year after year. So we needed to make a change. It was our benefits broker who brought to the table an option that many brokers still don't consider.
New England Life Care had over 500 employees at this point in time. A large group like that is a group that you have to really manage the healthcare expense. And so an ICHRA is a really good way to do that.
We were on the cutting edge of ICHRA coming out, and just like me, a lot of the employee population had never heard of it.
We were probably an early adopter on many levels.
I always say in New England, I think we're very parochial here, and frankly, we're resistant to change. There always is a little bit of a tension with employees or a suspicion sometimes that, does the employer have a different motivation for doing this?
There's definitely some speculation. Of course, conspiracy theories started to fly where, it's just the company trying to save more money. We don't know how this is going to benefit us, but I said, okay, let's give this a try. Probably one of the biggest stressors was more of like an information overload. Now, instead of 3 options, you had 20. To expand those options so drastically, I think can sometimes have people in a state of paralysis.
It definitely was an education effort. That was where the focus was on.
Your employees need a trusted advisor, and it needs to come from your HR team. We had town halls, we had open office hours, our phone lines and our emails were open.
Their benefit managers, Jessica Halliday, that I've worked with several times, made it so simple. I didn't have to do any of that legwork, so I really didn't become scared because I knew I had the support behind it.
We have 5 generations in our workforce here. So when it came to changing significantly how our staff of varying demographic ages and stages purchase health insurance, they had varying needs through that process.
We were given plenty of resources, a bunch of Q&As, a bunch of guides, even videos to help guide us through ICHRA as well as Benefit Bay.
Benefit Bay, which is our ICHRA administration partner, was paramount of importance.
What stood out about Benefit Bay was their customer service as well as their technology platform.
You can really take a look at your life and say, hey, are my kids really accident prone? Should I really be worried about going to the ER every other weekend because, they're doing something crazy? You get to kind of weigh the risks of each decision and be able to say, what's going to give me the most bang for my buck and the maximum coverage, and where do I see, my health, my family going over the course of this year?
Before working here, I was under my dad's insurance. He was the one that handled pretty much everything in terms of our health insurance. I never really thought too much past that because I didn't really make too many trips anywhere health-wise. I was like, wow, there's a plethora of information. I just sat with it to break down what I was going to sign myself up for.
There was every option that you could actually take to maneuver through that system and find what the best opportunity was for yourself or for you and your family.
The cost of health insurance keeps rising, and the plan designs are getting less and less and less. So ultimately, the employees paying higher premium costs as well as more out-of-pocket costs. Something's got to give at a certain point. So I think ICHRA is that doorway to change for this whole industry and market.
During the 5 years that we've been in the NICRA program, the cost savings for our employees and for our company has been tremendous. Our employees have avoided more than $3 million over 5 years.
Nearly 70% of our enrolled staff right now are still paying what they were 5 years ago or less.
So I had reduced my cost of about $3,000 a year, which I think I offered her to take her out for a beer, but I probably can't put that on camera right now.
The addition of ICHRA has really given us another arrow in our quiver for employers in specific situations that might be looking for something different.
Looking back on it now, we've come light years ahead, and not only have we grown in staff, the enrolled population has grown from when we were on group medical to ICHRA. We've adopted it, and they're out there telling their peers, this is great, and you should look into it.
It's really something that has done wonders for my family. So if anybody is setting this up for you as the employee, that's good. All right. Well, hey, it was really nice having you here, folks.